where is the roller? Over here. Okay. Now, when it comes to forearm technique, we have to, when it comes to deep tissue and forearm techniques, you want to use your body wisely for a few reasons. First, if you work inefficiently, you're wasting energy. And if you're wasting energy, you're not feeling comfortable. You cannot really deliver a nice focused treatment on someone if you are using too much energy, you're becoming insensitive. Yeah, so you need to really feel and master the art of preserving energy. And that's why we're using the posture correctly. That's why we ask you to use your lower body. That's why we ask you not to use your hands soft. This is feather. It should be accompany their body, contour, and be sensitive to. All of the strength should come mostly from the leg. This is the metal. Yeah, this is where the force is coming. Still sensitive, but that should be really light. Don't put any pressure or stress in your hands because you can't feel what's going on there on their body. So when it comes to forearm technique, because you're using quite more weight of your body, we need to be even more careful in the way that we're doing it. And I see quite a lot of therapists using forearm technique in a way that becomes quite uneconomical. So I brought this roller to give you an idea about how to use your body correctly. This would demonstrate the forearm. Yeah? And yes, it is a roller, but actually in real life, your forearm would glide similar to the roller because you have oil. This is the arm, and my hand attached to my body. Now, the question is where to put your body weight in relation to the forearm. I can do it this way, I can do it that way, yeah? I can do it this way, yeah? On the other side. So, what makes sense? So, here we have the roller, and we try to see how can I apply a deep pressure that's still slow and look at the relationship between the forearm and the rest of the body attached to this metal arm. Now, if I'm applying the pressure only down, I'm not moving, isn't it? I'm kind of static. Might be good. If you want to create a nice slow moving and you want to move this way, if you're applying the pressure, if you're applying your body forward, like doing that, you're actually going to the opposite direction. You don't want it. Now, if you want to overcome that, you need to put a lot more pressure to just drag your forearm forward. You see how inefficient it is? If you take your body weight really there, you're losing the force. So you're kind of gliding. Now, to put weight, then you have to put weight onto the body, then you have in an unfavorite point to really press your forearm down. It will be a lot better if your body would be there to do it for you, rather than pectoralis muscle. Yeah? So you can't go too flat. So what you need to find is exact position when you're not straight there, not too forward, and not too down. You have to find just few degrees to where, if you're in the right position, then only moving with your legs would make this whole system works for you. Easy, soft, deep, confident, no bumps, no jumps, no drama, yeah? So let's try to do that. Let's try to do that. You're taking the towel that way. Yeah. And it's nice that the table is low. I'll just demonstrate how you can still work with a low table. Yeah. Now is the second part of the course. Try to develop the art of not following exactly the lines of effleurage. So yes, you can do it in more the lines, but when it comes there, wrap around the shoulder. When it comes to effleurage, even really move, and you know how it is. If you're relaxed with it, if you enjoy it, they will enjoy it as well. So find the joy. No one else can do it for you. You have to find it. The joy of movement, and work in such environment. Work together with them. So petrissage, and then you are ready. You're ready to set it. You're setting the arm. You're finding the right place for you as you think. And let's say you want to work on this point. So you can start this way. Anything that you want to improve in the way that I'm doing it?
Posture.
I want to use this arm.
Okay.
I need to move backward. Yeah? So you see, I have to really displace my body to move backward. Now, if I move too much, it's too much, right? So I need to find a place. And usually I would say start with this kind of 90 degrees. Yeah? So start with a 90 degrees angle. And just slowly sink in. Try to relax the fingers. Try to see where it's comfortable for you to put the other hand. This way, that way. And then start sink to 10. 1. Okay, I'm not moving yet. Then, where should I move my body? Backward or forward? I need to go backward. So actually, it's something quite amazing what happened. Because I move backward, my hands start gliding forward. Don't do it, let it be. And it's quite hard. Again, if you can you come closer, really close? I want you to see this kind of small moment. So I don't move. Now look at my head more. If I move there, do you see what happened? So that's it really. From here, I move. Then I'm ready to move with my legs. So there is a small moment that you actually do the opposite of what you want. If you want to move forward, you move backward. And then you catch up with it. Okay? Again, from here, let's say from here, you sink, I move slightly backward, the tissue starts moving it forward, then it's the leg. I actually move with my legs. I have to catch up with my legs. If I will do it and stay there, that's what would happen. I don't want it. I want the same relationship to always be there. So if I do it super quick, that would happen. Front knee. Okay? Then, when it comes to moving, I will adjust it slowly by just doing that. Yeah? That the whole movement should be based on. Okay? And why? If I start moving that, it brings a jolt to the system. Yeah? When I reach to the scapula, as some of you already done, you rotate. Do you see the rotation? Now the rotation does not happen from the shoulder. It's actually happen from the legs. The way you work your legs is this way. Okay? And then, to just make the party even nicer, you can just continue with a nice stretch opposite direction. So really link things together. Okay, you finish that. Ask yourself, what else I can do? Even link to the other shoulder and just link. So you make it a dance, really. It's not technique. It's not... Make it as long. Even from here, if you want to then continue in doing another one, I don't know, your creativity, okay? So when it comes to the turn around the scapula, if you're there, you see how the movement of the leg would actually help you. Yeah, there is a little bit of arm movement, but try to minimize that. Then let's do the opposite. You're coming from above. You can do the same thing. So again, you putting yourself, organizing yourself, and then sinking in. Can I go deeper? Is it deep enough? And then moving a little bit backward, and the tissue starts to propel me forward. Leg adjustment. If I don't adjust with my legs, I will end up in a flat position. Check with them, see. See you right there?
Constant when you're adjusting your legs?
Sorry?
Still giving the same pressure?
Same pressure. Now, I can do that because I don't start to move. If I step, the pressure would be too much. But the small adjustment, you work right on skates, like you're doing skates, yeah? And then when you come here, you can either take and do the other side or find something. Maybe do you want to end up with that kind of movement? So finish it in any way you want to. Maybe a few more technique, nice technique on the shoulder, on the upper trapezius. Yeah. You can come to here, and then it's pretty much like standing. You need to lean forward with that. Question is what you do with the other hand. You know, you can put the other hand there. You can assist with the other hand on the shoulder, or even do it on the hip. Now, when I'm coming to this position, it's kind of unfavorite for me because I can't press down. It's hard. I need to use my weight. Do you all see it? So then I wouldn't, you know, every technique is good for range. So I would leave it. And you can do the same thing standing. You just have to come quite close to and really lean nicely. So basically, two hands. The most of the pressure goes onto the upper trapezius, but the other hand on the erector spinae on the same side. So really soft. And think about circle. So it's the circle that your body is doing. Yeah, quite low. Yeah, so how you're breathing into it. Yeah. And it's not only the forearm, it's from here a nice effleurage, and then you come back to it, yeah? So really try to link it. It will take some time, you know, but think about it as a sentence, not as just letters separately. Yeah, I think there should be enough. Let's practice that. In the late afternoon, we'll do more and I'll show you more maybe forearm technique. We'll see how it goes with the group and cool. Any